Hi everybody, I'm Tasha, registered nurse, and today I'm going to discuss the importance of taking a blood pressure and how to properly measure a blood pressure. Joshua, please show the audience. All right, so why is taking a blood pressure important? The American Heart Association defines high blood pressure as a major risk factor for heart disease and stroke. We know that nearly half of American adults have high blood pressure and they don't even know it. So proper measurement and treatment for hypertension can actually be the difference between life or death. So today I'm going to demonstrate how to measure a blood pressure properly. Before I get into that, the CDC does suggest that blood pressure screening should start as early as age 20, and that's something that can be done in your household, in a doctor's office, or in a clinic. So Amelia is my patient today, and we're going to start off by having Amelia make sure that her legs are uncrossed. We're going to keep her heart at heart level. And in this instance, this blood pressure cuff is a little bit bigger than Amelia's arm, but we do, in a traditional setting, want to confirm and make sure that our blood pressure cuff fits our patient properly. Otherwise, it can misread the blood pressure, okay? So we're going to first check for the brachial artery. The brachial artery is going to be in the interior part of the arm. So I'm going to palpate and see if I can feel her pulse. And Amelia has a very strong pulse. So we're going to take the blood pressure, or take the cuff, and actually place the cuff where the arrow points along the position of the artery. We're going to go up about 2 inches above that artery, and we're going to snugly apply that cuff along her arm. And so first, what I want to do, I'm going to a little bit more, Amelia, sorry. Perfect. And so first what I want to do is I'm going to pump up my blood pressure cuff enough that I can not feel the artery palpate or be palpable. So that's our first thing. I'm going to have you hold back for a demonstration just to make it easier. So we're going to first pump up our cuff, and I'm feeling her artery. And we're going to go up about 2 millimeters of mercury as we pump the cuff. And I got about to 80 before I stop feeling the pulse. So I'm going to deflate the pulse, the bow. And so in traditional settings, we would wait about 30 seconds before we actually pump up the cuff again. But for demonstration purposes, we're going to continue. So I'm going to get my stethoscope. And there's 2 ways actually to use your stethoscope. You can use the diaphragm or you can use the bell. The bell actually picks up kind of less audible sounds. But I'm going to use my diaphragm for demonstration today. So we're going to place the diaphragm on her brachial pulse. And I'm going to go up 30 millimeters mercury above 80, which is where I did not hear her pulse anymore. So we're going to go up to 120. And then slowly deflate until I hear the first sound. Okay. It's 98. Good. 98 over 68. So her top number is her systolic number, and her bottom number is the diastolic. What's important about a systolic and diastolic is it gives us the measurement, or it gives us the diagnosis of hypertension. And of course, her blood pressure is normal. The American Heart Association diagnose, or they suggest that a blood pressure that is above 120 over 80 is actually considered hypertension or hypertensive. For this purposes, she's a healthy young individual. She does not have high blood pressure. So things that we can do as far as proper treatment for someone who has hypertension would be to definitely indicate lifestyle changes with control of their blood pressure, and ways to do that. Some modifiable things that can be done is a healthy diet, which is low salt, low fat, and fresh fruits and vegetables. For those who smoke, avoiding all nicotine products, including vapes, cigarettes, any sort of nicotine can definitely help to decrease the risk of building up plaque in the arteries, which essentially will accelerate to high blood pressure. And then lastly, making sure that you get plenty of rest at night. Sleepless nights can definitely attribute to hypertension. So I thank you for listening for this presentation, and that ends this session. Thank you.